Coronavirus cases are surging in Arizona. The state's stay-at-home order was lifted on May 15th, and now COVID-19 patients are filling a record number of ICU beds there, even as states like Arizona open up. Dr. Anthony Fauci is saying that people still need to practice social distancing.
When you open, that doesn't mean that everything is okay and you can do whatever you want. You still have to practice a degree of caution and carefully go through the process of trying to normalize. That means you still should be wearing a mask. You still should be trying as best as possible to have that physical distancing.
NBC News reporter Vaughn Hillyard joining me now. And Vaughn, to put this in context, on Sunday, Arizona had more than 1,400 new coronavirus cases. That's more cases than New York and New Jersey combined. How are hospitals there handling this spike?
And actually, just this morning, we got word that there were 1,500 cases in just the last 24 hours. If you look at the last 6 days, Allison,
wow,
there have been more than 7,000 cases across the state. This goes back to May 15th, when Arizona Governor Doug Ducey decided to let the state's stay-at-home order expire. And it's been in the last 3 weeks that you've seen that spike in cases. You ask the question, how are the hospitals dealing with this increase in cases? We're outside here in Phoenix at Valleywise Health Medical Facility, where they've actually taken in some patients from other hospitals that have been at ICU bed capacity. Across the state, there are 11 hospitals that have already hit ICU bed capacity, and more than 500 patients have already had to be transferred to other hospitals because of capacity issues. I want to let you hear directly from Dr. Michael White, who is the Chief Medical Officer here at the medical facility. Take a listen.
Certainly, as we've seen people return to being outside, more interactive with one another, we have seen an increase in a rise of the incidence of the disease to do this. We also increased our capacity for testing, which has led us to see more positive patients. But certainly over the last week, we have seen a marked increase in the number of positive patients that we are seeing here within our clinics and within the hospital itself needing medical services.
Allison, I was also talking with the CEO of the Arizona Hospital and Healthcare Association, and she told me, based off of this trend line here, that the hospital system here should be very concerned in which direction this is going. Again, 11 hospitals have already met ICU bed capacity. And when you also look at the numbers here in the state, the reality is over the last 3 weeks that these numbers have gone up, and the incubation period is 10 to 14 days. And so as folks have increasingly gone out into the public without masks, without social distancing, those cases have only continued to rise. Allison.
Vaughn, do we have any sense of what the governor's plan is for dealing with it? Is there a chance that the state's stay-at-home order could go back into effect?
It was about a month ago that retail and restaurants were able to open again, and it was at May 15th when the stay-at-home order was lifted. You know, it has only been in the last couple of days that Banner Medical Center, they're the largest hospital provider here in the state. They said that they have seen a quadrupling of the number of ventilators since the governor lifted that stay-at-home order. Reached out to the governor's office here today, have not heard back. The last time that I spoke with the governor about this was last Thursday, June 4th, when I asked him, I said, it was actually on May 20th when I asked him the question. I said, if these numbers do go in the wrong direction, are you essentially ready to change course and go back to some more of these cautionary efforts? And he told me that the numbers were only going in the right direction and the state would be cautious if they were to go in the wrong direction. So fast forward 3 weeks, well, that's where we find ourselves. And when I asked the governor that on Thursday, he said that, quote, the state is not yet in crisis, meaning that not all of the hospitals are yet overwhelmed and that there is still capacity. And that's why they have this surge line in order, so that if a hospital is saying that they are at capacity with ICU beds, that they're able to call up another hospital and send those patients over there. Of course, much has changed in those 6 days. As I've said, since June 4th, there's already been 7,000 new cases. And there has been silence from this governor who made it an effort to reopen the state. In conversations with the governor's office over the last days, without the governor's office explicitly framing it as such, but the decision has been made by the state of Arizona to concede an increase in cases, concede an increase in deaths in order to keep the state open. And Allison, we're now seeing the apparent consequences of that.
Vaughn Hillyard in Arizona, they're seeing quite a spike in cases. Thank you so much.
Thanks, Allison.
More than a dozen states are seeing a spike in coronavirus cases. So what's causing these new hotspots? Here's what former CDC Director Scott Gottlieb said this morning on the Today Show.
We never really crushed this virus. We reopened against the backdrop of a lot of spread. And I think what we're going to see is continued pervasive spread, and these hotspots flare up from time to time. We really don't know where it's coming from right now, and that's the concerning thing.
NBC News medical contributor and internal medicine physician Dr. Lippy Roy joins me now. Dr. Roy, it is so great to see you. Why are we seeing a spike in certain states? People want to know, is it reopening? Is it the protests? Is it just too early to tell at this point?
Allison, it's so great to be with you again as well after what seems like so long. And yeah, the short answer to your question is really all of the above. It's a combination of things happening. Yes, people are congregating because of the protests, but also remember, a lot of businesses are opening up. We had Memorial Day, and we're seeing several states with a rise in cases because of all of these different events coming together. So yeah, it's probably a combination of things, Allison.
Dr. Roy, President Trump has said the rise in cases is because of testing. Can we consider increased testing a factor in all of this?
Yeah, that's a great question, Allison. And yeah, so logically, you'd think that if the more testing you do, then the more positive cases you'll get. But remember, tests could be also negative, but we're not seeing negative tests. We're seeing positive test results, right? So yeah, I mean, remember, testing isn't the problem. We actually need more testing, right, to get a scope of the problem. So the fact that the tests are coming out positive is indicating that this pandemic is still active, and it's the virus is out there. We just really need to double down on our efforts of preventive measures. The physical distancing, the wearing of the masks, and the hand hygiene. I understand that the physical distancing is difficult with the protests going on, but I also want to make a clear point that racism is a public health issue. And I am so inspired by all the young people out there who are protesting, but we're still in the middle of a pandemic. So I urge young people to take that activism home, that passion home, go online, donate, reach out, email, and call your local mayor's office, your local members of Congress and Senate. They need to hear from you. As President Obama said, change happens at the local level, but you can be an advocate for both social justice and public health.
Yeah, there are plenty of ways to continue that activism safely at home as well. Dr. Roy, one last question for you. Dr. Fauci says the coronavirus is his worst nightmare and that we are still at the beginning of this pandemic. What's your take here? Are we still only just at the beginning?
You know, Allison, that's such a great question, and many people have been asking me that. So when a global infectious disease expert like Dr. Fauci, who has been working on the HIV/AIDS virus for the past 40 years, when he says that he is almost like stumped, those are my words, by this virus, I mean, that must say a lot. You know, we, as all of the health experts have said, we are learning something every day about this very tricky coronavirus. It doesn't just affect your lungs, it's your GI system, your heart, your brain. So we have a long way to go, Allison.
Dr. Roy, as always, it is wonderful to have your expertise. Always great to see you. Thanks for joining us again.
You too, Allison. Bye-bye. Take care.
See you soon. Talking to the Senate Small Business Committee today, Treasury Secretary Steve Mnuchin said the U.S. economy will rebound significantly from the coronavirus crisis, but we still need more stimulus.
I definitely think we are going to need another bipartisan legislation to put more money into the economy. Whatever we do going forward needs to be much more targeted, particularly to the industries and small businesses that are having the most difficulty in reopening as a result of COVID-19.
NBC News senior business correspondent Stephanie Ruhle joining me now. And Steph, the Treasury Secretary there talking about the industries having the most trouble reopening. Who falls into that category? And do we know what kind of help the administration is considering here?
Well, what you heard right there was the Treasury Secretary really speaking to Republicans in Congress, saying, please help. Remember, the Democrats already have their next stimulus bill ready to go. And the Republicans have said, hold your horses. Let's see how the money goes. Let's take a breath. Steve Mnuchin right there is making it clear Americans need more money, right? Republicans are looking at the stock market saying things are great, but we know small businesses, over 100,000, have already shut down completely. And the industries that he was talking about are the obvious ones: retail, hotel, leisure, travel. They've been hit the hardest. Many of them haven't reopened yet. And if they have, it's very sluggish. He also said that the American people, so he kind of gave a wink and a nod that maybe we're going to see a second round. I don't want people to get too excited of those stimulus checks.
Steph, he also said to look out for more guidance this week on PPP loans. What are you expecting there?
Good news. The Treasury is starting to realize PPP, this is the $600 billion small business program, which has been positive. It had a very, very rocky implementation. But look at the jobs number last week. We have seen a lot of people get rehired in the last couple of weeks, in the last month. But the government is realizing, with reopening being so staggered and so slow, here I am in New Jersey, we haven't even gotten to phase 2 yet. A lot of businesses aren't open yet. So most likely they are going to loosen up the rules, what you can spend the money on, and give you a bit more time if you're one of the borrowers. That's a big positive.
Yeah, for sure. Steph, this week, the National Bureau of Economic Research said the U.S. has officially been in a recession since February, but some economists are starting to call this a she-session. In the month of April alone, women accounted for 55% of the total job losses in the U.S. What's going on here?
A she-session is right. And listen, hopefully it won't be a long recession or she-session, but take African-American women. Almost 20% of African-American women in this country lost their jobs between February and May. Let's talk about a couple reasons why. Who got clipped first? Low-wage service jobs, not white-collar executive jobs that you can do from home that are most often occupied by white guys. And when schools closed, most often a parent had to go home, oftentimes voluntarily leaving their job, and that has most often been a mother. This is a huge blow to working women in this economy. We have seen the gains we've made in the last 10 years wiped out. Now, we're hoping with rehiring, we're going to see that come back, but it is so disappointing to see women get hit this hard.
Absolutely. A she-session. If that is in fact the case, we hope it is a very short one. Steph Ruhle, great to have you on. Thanks a lot.
Thank you.
Some members of the Washington, D.C. National Guard have tested positive for the coronavirus after responding to George Floyd protests near the White House. NBC News political reporter Ali Vitale joins me from Washington, D.C. Ali, do we know how many National Guard soldiers tested positive?
Allison, we don't, and excuse me, I'm in a battle with my hair right now amidst the wind, but we do know that some members of the National Guard who were out here during the protests for George Floyd's murder have tested positive since then for coronavirus. But D.C. National Guard aren't the only ones who were out here. You had National Guard from other states, Tennessee, Ohio. We don't know if those National Guard members have also seen cases of coronavirus since they've left D.C. and gone back home. But I think the larger point here, Allison, is that this is the thing that experts were afraid of. They were afraid that as law enforcement and protesters alike were out here in these protests, we were going to see a continued spread of coronavirus because despite the masks, there hasn't been a ton of social distancing. And when you put out tear gas, when you do things that make people cough, when people are in environments where they're screaming, that's a whole lot of possible exchanges right there. And so this is sort of what experts have long been warning about as we've seen the rise of these protests.
Ali, is there a push for more protesters in D.C. to get tested now?
Absolutely. Even just in my social circles, as I scan my Instagram feed, I'm seeing folks who say that they've been at protests, so they want to go get tested. And this comes at a moment where states and localities like D.C. were already pushing people to go out and get tested. Now, it's just that extra layer of, if you've been out here in the protests, it's just another reason for you to go out and try to get tested, because a lot of these testing facilities, especially the ones that are state-run, they're loosening the requirements around who can show up to get them. Some of them no longer require a doctor's note or symptoms. You can just walk up without an appointment in some of these cases. And so certainly here in the district, but also writ large across the board, we've seen people urging protesters, go get tested if you've been out at a protest.
Allie, we're hearing that fencing that went up near the White House after last week's protests could come down soon. What do you know about that? And are there plans to bring in more security if it does come down?
So there's two parts of this fencing, because it goes around the entire White House complex. There's that area that we've been talking to you from, that we're right down the street from here, which is in front of Lafayette Square Park. That fencing is staying up. The Parks Department telling us that they're talking with Secret Service and Park Police about how long that's going to be up and what it looks like if they're going to start taking it down. Though I would mention that that fencing had posters and signs and banners put on top of it. All of those have since been removed, and that might be a sign that we're about to see that fencing come down. Then on the other side of the White House complex, where I was this morning, we started seeing the cement blocks that were behind the fence, sort of extra reinforcement there. That started to come down this morning. So at least on the south side of the White House, we're already starting to see that fencing come down. TBD on what happens, though, at the fencing in front of the White House.
Allie, D.C. passed sweeping police reforms this week, but they didn't address calls from protesters to defund the police. It's a message that is now painted on the street in D.C. Where does the mayor stand on defunding police, and is this something the city is considering?
The mayor, at least, has spoken out against it. She's defended her budget, saying that she knows what D.C. communities need and that her budget puts not a penny more and not a penny less in funding with the police department to keep communities in Washington, D.C. safe. That being said, that sweeping package of police reforms, that was yesterday. You were right. They didn't mention defunding the police or reallocating any of that money and resources. But that being said, in a few weeks, we expect the city council to revisit the budget, and that's when changes could come, if they decide to make changes at all, Allison.
All right, Allie Vitale, I know you said your hair's battling the wind, but if the wind works for Beyonce, it works for Allie Vitale, too. Looking good, sounding great. Always happy to have you. Thank you so much.
Thanks.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.